Good morning, everyone. Again, I am back to explain some few important questions in previous AIMS paper, and that is partner. And they asked first question here. Once you see, what is the difference between systolic and diastolic pressure? And the difference between systolic and diastolic pressure is pulse pressure. And here you can see that what is the normal value of pulse pressure is 40. If the person has the 40 mm of Hg, then you can call that person unhealthy person, right? Okay, so this is the formula to calculate the pulse pressure, systolic pressure minus diastolic pressure. Okay, the next step. What is the formula to calculate the basal metabolic index? And the formula, all we know that weight in kgs divided by square of height in meters. Then third question, which instrument we can use to check the ear? For examination of ear, the one that is the otoscope, and for examination of eye we can use the ophthalmoscope, and proctoscope we can use to check the anus, rectum and sigmoid examination, and laryngoscope we use for the larynx. The next step, DAS enema is also called as antispasmodic enema, so that simply we call carminative enema. And the what is the purpose of this carminative enema? To used to relieve the gas and bloating sensation in the abdomen. Okay, the next question, the sudden fall of temperature from high to normal within a few days is called, we can call true crisis. Okay, sudden fall of temperature, sudden fall of high temperature to normal, so that we can call true crisis. And normal stroke volume is 70 ml. And the site of pulse, if you are checking at the neck, and that pulse call carotid pulse. Okay, the next step, the fever in which temperature remains above normal throughout the day and fluctuate more than 2 degree Fahrenheit is called remittent fever. And nothing but the remittent fever is not throughout the day, it fluctuates, sometimes it go high and sometimes it comes down, but it not comes to normal, it never come to the baseline, so that you can call the remitted changes you can see in the fever. Then gusmal breathing we can see in the people who has the problem diabetic ketoacidosis. Then next step, the discolorization that appear in the dependent area of the body after death is called liver mortis. Okay, so here stages of mortis you can see here. First stage, second stage and third stage. First stage is called liver mortis, second stage algar mortis, and next one is rigor mortis. And rigor mortis is a stiffening of muscles after death and cooling of body after death called organ mortis. And here what the question they asked, discolorization after death is called liver mortis. Then what is the purpose of absorptive dressing are intended to? So what is the use of keeping absorptive dressing on wound is to remove the drainage from the bedsore. Okay, then the normal specific the normal specific gravity of normal urine is 1.01 to 1.025. Okay, then next some medical abbreviations you can see here, QOD, QH, QD, BID. So here Q stands on every, so QOD every other day, QH every hour, QD every day, BID 2 times a day. Then next chylosis, cracking of lips. The medical term for chylosis is called cracking of lips. The next normal breathing rate and depth we can call eupnea. And example of dry cold application, ice pack, ice cradle and ice pack. And the example of wet cold application, cold compress. Then movement of joint away from the midline of the body is called abduction. Okay, here you can see abduction, and in diagram you can see abduction and reduction. Next one, HbA1c glycated hemoglobin value reflects the blood levels in the past months, that is 3 months. Okay, then next, main intracellular cation is potassium, and here also you can see extracellular cation is sodium, intracellular anion phosphate, and extracellular anion is chloride. Then the medical term for somatitis is inflammation of oral mucosa. Thank you.